Hello, I'm Wendy St. Peter, and I've recently completed an evaluation of Cinacalcet Initiation in hemodialysis patients. Other investigators and I used the DaVita data set, 45,000 patients, and we merged that data with the Centers for Medicare and Medicaid Services to get a nice combined data set where we looked at the use of Cinacalcet. What we were interested in looking for was what were the predictors of Cinacalcet initiation. And what we found is that Cinacalcet was more likely to be initiated in patients that were African American, that were younger, that were women, and had longer duration on dialysis. And so those factors were interesting to us. We also found that African American patients were started on higher doses of Cinacalcet at initiation. And all those really have implications for the end-stage renal disease bundle that will go into effect in 2014. Because when the bundle goes into effect, phosphate binders and Cinacalcet will be included in the bundle, and dialysis units that have higher proportions potentially of African American patients that can't spread their risk with these higher cost medications across multiple dialysis units may have some issues in terms of being able to afford the cost of high cost medications like Cinacalcet in patient populations that are, for instance, predominantly African American. Right now, the case mix adjusters for the end-stage renal disease bundle do not include African American race, and so that's an issue. There are some other things that we have to do to determine whether this predictor of African American race is one that's truly a predictor of Cinacalcet initiation. One of the things that we still need to look at, and we know that high-cost medications are oftentimes prescribed for patients that have low-income subsidy status under Medicare Part D. So we do need to look further and potentially do some adjustments in that data for low-income subsidy status or dual eligibility status.